Hi everybody. I'm so happy to be here with you today. I'll be offering a short sequence for pregnant bodies to relieve low back pain and discomfort. So these few exercises can all be done safely at any point during your pregnancy. If you're having acute back pain, these are designed to both give stability and space in your SI and your sacrum and your low back. But if anything that we're doing feels like it twinges or sends shock or pain through, back off. You don't want to push through any sort of discomfort for this sequence. First, you will need a ball, a small pillow, a yoga block, or just something that's about the distance of your pelvis apart. If it's a pillow, it can be a little bit bigger because it squashes down. If it's a yoga block, you can decide which direction to use it so it fits your body. And we're gonna take the ball and place it between our inner thighs. And so you wanna stand about the distance of the ball apart and make sure that your feet aren't so close together where you feel like you're kind of squeezing or death gripping. You just want to have this prop in between your legs allow a little bit of activation and support for your core. So as you're standing, our bodies, since they're more weighted in the front and the abdominals are lengthening, they tend to, this is an exaggeration, but go into this sort of sway back shape. So you want to feel your low abdominals, and they're not tightening or tensing, but they're slightly lifting to give your low back a little bit of space. You want to do that without clenching the glutes or the thighs. So it's this little bit of energy that the prop is igniting in your inner thighs that helps you support and stabilize your low abdominals to lengthen your low back. Just give a little lift of the toes and lift of the heels to shift your weight back and forth on your feet. And then find a place where you feel like you're centered over your arches. Lift your low belly slightly, lengthen your low back, bring your arms by your side, and just sort of shake everything. Just gently shake and loosen. No tightness, no tension, allowing energy to move through the body. Come to a place of stillness. Close the eyes. Gently reach through the center of the foot. Gently reach through the crown of the head. And breathe. Inhale, lungs expand. As you exhale, just give a little squeeze of the prop from your inner thighs. It's almost imperceptible. Don't squeeze your glutes, don't squeeze your quads. It's just this little tiny support. And inhale, allow it to release. And exhale, little squeeze of the prop to lift your abdominals, lengthen your spine, lengthen your low back, and release. Exhale, little squeeze to lift and lengthen, no tension, no strain. And the release is just as important, if not more. 2 more, exhale, little lift and squeeze. And last time, little inner lift, inner thighs, pelvic floor, low abs, and release. Give a little shake, 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 letting any tension that maybe showed up in your booty release. Keep that sense of release. Exhale, little small squeeze, maybe just about half of the intensity that you just did. So you're just slightly supported. And you're gonna inhale, reach the left arm up towards the sky. So you're staying supported. And you're lifting your rib cage up and off your pelvis and lengthening. Now, watch that you're not bending over and compressing one side of your waist or back, but it's this real lift up, out of your body. So again, watch that you're not collapsing, watch that you're not jutting the ribs forward, but you're in your center as best you can, lengthening up and over. We're holding this and breathing. Inhale. Now exhale, just gently engage the side of your waist to return. Very nice. And again, exhale, little gentle support. Inhale, arm comes up. Exhale, up and over. Feeling the support, feeling the gentle lifted engagement, lifting up and out of your waist. Soft shoulders, soft jaw. Top side of the waist gently engages to help you return. And again, inhale, up and over, a little gentle press into the prop. Staying supported in your center, soft shoulders, even softer jaw. Exhale, top side of the waist, pulls into return. And again, inhale up, center lifting, low back is long and spacious, upper body is soft. Exhale, top side of the waist, brings you back to the center. Let's do that a couple more times. Inhale, up, exhale, support. Inhale, more length, and exhale, return. Inhale, up, over, support, lift, lengthen, and return. Last time. And up and over. And reach. And support. And lift. And return. And once to the last side. Up and over. Breathe. Long low back. Soft glutes. And exhale, return. Take the ball or prop out and just toss it to the side. Step your feet a little wide and a little externally rotated. And then we're just gonna do a gentle rotation to release anything that maybe got stuck in the mid-back, the glutes, and the tailbone. And again, if you're feeling acute in your back, any sort of pain, you make this small. It's sort of like an anti-Pilates thing. It's more of a fascial release. So you don't have to inhibit the movement at all or stabilize. You're just allowing the body to move. Keep it small if you need to. For 4, and 3, and 2, and 1. Come back to the center, legs externally rotated. We're just gonna bend the knees, feel the length in the tailbone, little gentle lift in the abdominals. Inhale up, and exhale through the center. And up, and exhale through. Again, keep it small, moving the energy. And exhale. Inhale up. And exhale. If your back is overarching, bend the knees less. If you have more range of motion, you feel good, you can go all the way down. And up. And it's up to you. Exhale. Inhale, gently moving, lubricating, strengthening the hips. And inhale. 3 more. And up. And 2. And up. And last time. We're gonna pivot the feet into parallel. Bring the elbows to the knees. And gently fold forward. So the support of the elbows on the knees helps support the abdominals in the back. If this feels like too much traction, come out of it a little bit. But if you have space and this feels comfortable, you can go down into a forward fold as far as you want. Allowing the head to drop, feeling the gentle lengthen and traction through the spine. You can shake your head if it feels good. We'll take 3 more. 2 more. Last breath, soften the knees and gently roll up. Inhale, arms lift, and exhale, arms by the side. All right, so this next little sequence, I have a yoga stool here, but this can very easily be done with just a dining room chair or a desk chair. You just want to watch that there's no wheels on it. This is actually like a little bit short for me. So I have a blanket on the floor for my knee because my knee just grazes the ground a little bit. But you can have a regular chair with the back facing behind you. And we're gonna sit sideways onto the chair. So back knee forward, and then this knee is hanging down. So right, see my knee here touches the floor. If I was on a dining room chair, I would be more like this. And actually it would be a little bit easier to get in the position because you want the leg, your thigh bone, rather than forward, little bit behind you. Watch that it's not so behind you that you're getting forced into an arch. So here we are with that just a little bit of support in the abdominals. The more you feel the abdominals lift, the more you'll feel some lengthening through here. So we look forward, inhale, the arm up, the front arm up, so the same arm as the back leg. So this side body gets to lengthen, this front body gets to lengthen. And inhale, lift up out of your knee, like you're reaching your knee down and your rest of your body up, so you get all of this space through the belly and through the front of your hip. Allow the shoulders to relax, but the reach comes through the back of the head, right? It's really, subtle, almost imperceptible, but you feel like you're being pulled from the top of the head, lifting up, so you're not sinking into your hip, but you're getting lots and lots and lots of space. If you want to have support, this back hand can be on the front of the chair. It can even be on the back of the chair. Breath in, and then exhale, very small, up and over. Breathing into the front of your leg. You can stay here for a few breaths or come out of it right away. And exhale, you're either still in the side stretch or you go back into it. Again, either hold it and breathe or come out. And one more time, exhale, up and over. This time we'll all hold together, reaching up, feeling the length through the front of the leg. And exhale, return. Beautiful. You're going to turn to the center with a wide leg stance for a moment. Bring your elbows to your knees and then just rock a little side to side. We're gonna round up. And let's go to the other side. So here we are, pivoting. Line yourself up. One thing I forgot to mention on the first side, you want to watch that this back leg isn't externally rotated. It will sometimes do that to try to get out of the hip stretch. So you almost want to feel like you're spinning your thigh bone in, like your knee is moving in farther than your foot. So you have this internal spiral of your thigh bone. Oh, here we are. Support with your back hand as you need. The knee reaches down towards the floor, right? It can be hovering or it can be off, just depending on the dimensions of your body and chair. Inhale, reach the arm up, gently supporting from your long abdominals and up and over. Breathe, breathe. Lifting up, out of the waist. And exhale. Return or hold it. Lift, lengthen, exhale, side bend. Breathing, keep the internal rotation of your back leg. I'm actually going to scoop my leg back a little to deepen this stretch. And exhale, hold it or return. And up and over. And return and bring the arm down and turn back to the center. Externally rotate, bring the elbows to the knees, and then just do a little kind of rotation, shimmy, shimmy. Let's gently round up to seated. And we're gonna arch the back slightly as you go forward. Drop the head, use your abdominals to round. Inhale and exhale. Obviously your range of motion will depend on how far your body will move. Exhale. You don't want to feel like you're forcing anything. I mean, your body's not going to allow you to go any farther than it can. But rather you want to feel like as you round back, your sit bones drop down, and that's what drags you back. And round. We're going to do 3 more. And 2. And up. And last one. And up. Beautiful. Feeling good? I'm feeling good. All right, here we are for the last exercise. So if you had this tall chair for the previous exercise, right, it would have looked like this. Oh, that actually feels better than the short one. And grab a small pillow or a cushion or something. If your chair is hard, you're not going to feel like the edges of the chair smashing into you. So this is a glute stretch and a hip stretch. Feels so good. You're gonna bring one heel or ankle onto the chair and then the knee onto the chair, and then you're gonna hop this long leg back. So the more parallel this leg in the front is, the more intense of a stretch it is. You're gonna start upright, so your back knee is bent and the leg is in a little bit of extension. Now you can hold the front of the chair, or you can have your hands on the bottom of the chair to take a little bit of the weight out. And this is real gentle, right? Because we don't want to push the chair and we don't want to tip the chair. So you're upright, keeping a fair amount of weight in your legs. Breath in Exhale, you're gonna gently straighten the leg, maybe not all the way, to tip your body forward. And inhale, bend to return. And exhale, lengthen and tip. And inhale. So if you're really, really tight in the outer hip, exhale, lengthen. You might not go very far forward. And bend. Again, just make sure that this isn't causing any discomfort in the low back. No pinching. And bend. We're just gonna do 2 more. Soft jaw, soft eyebrows. And last time, we'll lengthen. And then we're gonna hold it, supporting with the hands as you need to for 3 and 2 and 1. Get your back leg underneath you and then step the feet down. Let's just take a little hip sway, hip circle. After that, wee-hoo. And let's get ready for the second side. So, we'll bring the opposite foot forward, heel, shin, and then scoot the back knee behind you. Keep the back knee bent. See if you can find that same internal rotation. Breath in and exhale. Press. This side for me doesn't want to go as far. And return. Watch that you're not overarching your back. Exhale, lengthen. I forgot to mention, you can also do this on your couch. You know, so the couch is a little more forgiving, a little lower, and you've got this sturdiness to it. You can have your hands on the backrest of the couch. So if the chair feels a little awkward or unstable or too high, try it on your couch. It feels really good. Last 2. And bend. And last one, we're gonna hold it. 3, 2, 1. Bend. Get your back leg underneath you. And stand down. Separate your feet a little wide and hip circles. That feels good. My doula recommends doing hip circles all the time when you're pregnant, when you're brushing your teeth, when you're making food, when you're washing the dishes, just getting movement and softness and sensations go the other way into that area. Really helpful for labor and birthing. We go for, feels so nice, 2 and 3 and 2, and the baby legs in. And 1. Inhale, arms up. Exhale, arms down. And last one, arms up. And down. Thank you so much for being here with me today. My body feels better already. I hope you enjoyed the sequence and you use it when you need to. Just remember, if any of the things are making your back flare up, then just back off, do less, make it small. It's about making the body feel good and making yourself feel supported. Thanks for joining. Bye-bye.